Management of benzodiazepine toxicity. As a first step of management is investigation, we should do ABG, ECG, lab tests such as serum electrolytes, ethanol, acetaminophen level, and creatinine clearance. As for treatment of emergency toxicity cases, we should check for airway, breathing, circulation, disability, checking consciousness with ABO scoring system, and exposuring of all the body. For GIT contamination, we use activated charcoal, and the antidote for benzodiazepine toxicity is flumazenil. It acts as a competitive antagonist for benzodiazepines. As for benzodiazepine dependence, it is a condition resulting from repeated use of benzodiazepine drugs. In the case of benzodiazepines dependence, the continued use seems to be associated with avoidance of unpleasant withdrawal reaction, rather than from the pleasurable effect of the drug. Benzodiazepine dependence develops with long-term use, even at a low therapeutic doses. Tolerance results in a desensitization of GABA receptors and an increased sensitization of excitatory neurotransmitter system, such as NMDA glutamate receptor. These changes occur as a result of the body trying to overcome the drug effect. Other changes that occur are the reduction of the number of GABA receptor, which is called down regulation. Symptoms and signs of dependence, such as inability to cope without the drug, depressed mood, suicide and self-harming behavior and ideations, headache, and depersonalization and derealization. Benzodiazepine withdrawal symptoms are a normal response in individuals having chronically used benzodiazepines and adverse effect and result of drug tolerance. Symptoms typically emerge when dosage of the drug is reduced, such as diaphoresis, tachycardia, hypertension, low-grade fever, delirium, and hallucination. Xanax withdrawal timeline. Symptoms typically appears 6 to 12 hours after last dose and peaks within 2 weeks, and it lasts for 1 to 4 days. It may take months to years to disappear if not addressed professionally. Benzodiazepines chronic abusers should be provided with supportive care and gradually decreasing benzodiazepine use to avoid withdrawal symptoms and seizures. We should not use benzodiazepines with normal anxiety, such as exams and job interviews, and we could use benzodiazepine with anxiety disorders, and for sure we can use benzodiazepines or should use benzodiazepines with doctor prescription. We should use alternatives for benzodiazepine with severe anxiety, with lowest doses and least duration. Do not use with elderly, alcoholics, or drug abusers. Thank you.